I'm Dr. Christopher Francie. Thank you for joining me in this short video session on understanding and avoiding opioid abuse. Many of you have probably heard of the opioid epidemic. This refers to the increase in opioid-related deaths that we are currently experiencing here in the US. In response to this epidemic, we have created this short educational video to discuss opioids, why they are prone to abuse, and opioid-safe practices. Our goal is to better educate patients, the parents of patients, and the general public. But first, let's start out with some basic questions. What is an opioid, and where does it come from? Opioids are a type of analgesic drug, meaning that they treat pain. These type of substances were originally discovered in the opium poppy plant, hence they received the name opioid. You may have likely heard the name of many opioids, so let's take a look at some of the more well-known examples. Some commonly used opioids include meperidine, morphine, diamorphine, also known as heroin, and fentanyl. Keep in mind that some opioids are stronger than others. When the strength of drugs is compared, we use a term called potency. Compared to morphine, a commonly known opioid, meperidine is 8 times less potent, whereas heroin is 2 times more potent, and fentanyl is 100 times more potent. So why do we care about potency? Medical professionals use potency to determine how much of a specific opioid should be given to a patient to achieve the desired pain-relieving effect. For example, if a drug is more potent, less is needed to be given to a patient to elicit the same level of pain relief. If too much is taken at one time, or opioids are used too often, it can lead to toxic or deadly side effects. You may be wondering, how do opioids work? There are actually natural opioids in the brain, which bind opioid receptors. This results in how we perceive pain and reward. Medicinal opioids bind these receptors in the brain and produce the effects of pain relief. But what about opioid addiction, or abuse? How does that impact the body's natural systems? First off, addiction is the behavior associated with the compulsive use of a drug. The positive, rewarding effects of opioids initiated in the brain are thought to be the driving force in opioid addiction. Dopamine, a chemical in our brain, is believed to be a key component in this reward circuit. Opioid receptors in the brain affect other important systems in the body as well. For example, opioids impact breathing or respiration. Therefore, improper use of opioids can have some serious life-threatening outcomes. In fact, excess opioids in the brain can lead to shallow breathing or respiratory depression. This is the most common cause of death from opioid overdose. Did you know that adolescents are at an even greater risk for opioid addiction? Let's take a closer look at the brain to find out why. We can think of the brain as being divided into different regions. The prefrontal cortex is located near the front, and it is involved in decision-making. It is also continuously maturing until age 25. Conversely, the parts of the brain involved in pain and reward, which are crucial drivers of drug use, are the first to mature during childhood. Because the prefrontal cortex is underdeveloped in adolescence, opioid misuse and addiction can cause the reward system to take over. You can think of this as a bicycle with fully functioning pedals, representing the reward circuit in the adolescent brain, but with weak brakes, representing the prefrontal cortex. Therefore, adolescents have a more difficult time slowing down their reward system. In fact, data shows that adolescents who have been administered legal opioid prescriptions are much more likely to abuse opioids as they grow older. Now, this is all interesting information, but how can we avoid opioid abuse? One way is to not take opioids at all. In fact, some other options may work just as well or better for pain management, and they have fewer risks and side effects. Some examples include pain relievers such as acetaminophen and ibuprofen. Now, if you are prescribed opioids for pain, remember these 3 steps. monitor, secure, and dispose. First, monitor how many pills you have been prescribed, so you can tell if any have gone missing. Second, secure your opioid medication in a safe place. Third, dispose of unused medication to reduce the risk of misuse to yourself and others. Dispose of unused opioids in collection receptacles and call the DEA Registration Call Center at 1-800-882-9539 to find a local collection receptacle. Disposal through a pharmacy mailback program or flushing them down the toilet are also options. Now, the hope is that these preventative measures will reduce the risk of opioid abuse, including overdose. However, you may find yourself in a situation where someone has overdosed and is fighting for their life. In this circumstance, there is a prescription drug that can reverse the effects of an opioid overdose. It is called naloxone, and it can be given as a nasal spray or an injection. Many states have passed laws to increase the access of naloxone to bystanders and first responders. For additional support, contact the Substance Abuse and Mental Health Services Administration, SAMHSA, National Helpline with any questions you may have. Well, let's face it, the opioid epidemic is real. Our hope is that better education can help prevent this from happening to you or a loved one. Please spread the word, and let's take this on together.